Okay, class, I wanted to cover a few things because you guys have a quiz coming up on Tuesday in class, at the beginning of class, on infection control and safety equipment. And you should have covered most of this in lab on Monday. You should cover most of it lab on Monday night. But I wanted to give you a quick little overview of some really important things that you'll need to know specifically for the quiz because I want to make sure you're ready for it. So that's what this video is going to do for you today. So a couple things that I want to cover is first I want to talk about what is universal precautions. And universal precautions is something that was discovered by the CDC. They came out with it back in the 80s in the CDC. And basically it was to protect everybody from any type of bloodborne pathogen. So first of all, what is a bloodborne pathogen? Well, a bloodborne pathogen is what we see here, some type of exposure to a disease such as hepatitis B, HIV. So it's fluid on fluid. So we have skin that blocks us from getting this, but if we don't have skin or we have an open cut or wound, we would be exposed to blood in that open cut or wound. So that's what bloodborne means. It moves from it has to get through the skin, break the skin barrier. And so we put universal precautions in to prevent people from getting exposed to diseases like hepatitis B and HIV. Now, it is not okay to ask a patient what their HIV status is. You cannot ask any patient that. So why we do universal precautions is basically we assume that everybody we touch is infected or could be infected. So everybody we come in encounter with, no matter who it is, we're going to wear the proper personal protective equipment or PPE, such as hand washing with and then gloves. In phlebotomy, the only PPE that is required is gloves. Now there are some facilities that will have you wear goggles or face masks or face shields. It's rare, but it's not, I mean, you could see it. And then in other situations, you would have to wear gowns. But and we only do that if there's a large spill or splash issue. So that's what universal precautions is. It was set up by the CDC, but before the CDC became a thing, we had something called OSHA, which is Occupational Safety and Health Administration. And this is basically an agency that now kind of started overseeing the bloodborne pathogen issue, which we say here HIV, HBV, and HCV, hepatitis B and hepatitis C. They started setting the regulations first, and some of the things that they required were the utilization of safety needles, and they started requiring the utilization of biohazard waste cans and proper disposal of products that have blood on them. So that's where OSHA kind of came in. And their biggest thing was safety needles, that they wanted all blood collection equipment to have a safety device that can be activated by one hand. So you've seen the safety devices in the lab, and if you haven't, you want to make sure you ask Professor Matthews if you're in the evening class, what is the safety device? Now, my class, they've worked with them yesterday or the other day, so they're familiar with them. And after you collect a sample, that needle is required to go in a biohazard safety container that looks like this. It has to be a hard container that the needle can't puncture or come through. Now, if it is like blood or like a gloves or something that is just has blood on it, then it can go into a regular biohazard bag like this, or we have a trash can in the department that has a biohazard trash on it. So any type of regular trash, it doesn't have to be a hard container, can go in there. But anything that has a sharp, such as a needle, lancet, a piece of glass, they have to go in a hard, container like that. Gauze, Band-Aids, gloves, they are going to just go in regular trash unless they're saturated with blood. So we don't put anything in a biohazard trash unless, if it's been saturated with blood, then we'll put it in a biohazard bag. But if it hasn't been, we're just going to throw it in regular trash. So those are the requirements for disposing of products. Now, the other thing that I want you to take a look at is what is found in test tubes. So when we draw blood, we have test tubes that we draw them in. And all these test tubes have different additives in them. So I'm going to pull this over and show you a test tube right here. So these are some biohazard or Vacutainer tubes that we use, these colorful tubes. And every single one of them has a different additive in them. And here you see this one, it says lithium heparin. That has an anticoagulant in it. They do have some that have what we call an antiglycolytic, which stops the use of glucose. That's an additive. Any type of tube that has anything added to the tube to make the blood do something, like stop clotting, stop the use of glucose, we refer to that as an additive. And the one reason we talk about that is it's really important to understand that an additive is used to make sure that the blood is doing something, and we have to mix it really well for safety reasons so that the sample holds its integrity, so the sample doesn't go bad. So that's the general idea of our safety, but I want to stop here again and talk about exposure control plans. So these are some things that have been put in place because of bloodborne pathogen standards. We were required to put in an exposure control plan. Universal precautions became a thing, which we talked about. Everybody wears gloves. Everybody assumes everybody's infectious. Engineering and workplace control, that is the safety needles that have been put in place. Personal protective equipment, that is the gloves and gown and mask that we are required to use when you're drawing blood. We've also put in housekeeping standards. So there are certain things after a patient leaves a hospital bed that they have to do to clean the room properly to get it ready for the next patient to come in. They've implemented hepatitis B vaccines. And then also the requirement of how we label and record keep for the patient's safety. And we'll talk more about that in class. But I do want to talk about exposure control plan, because if a student or anybody ever gets exposed when they're drawing blood and they actually stick themselves with a needle after drawing a patient, there are a few things that you need to do. And if you ever get stuck with a needle, the first thing you want to do is squeeze the site and wash it with soap and water. And then you need to notify your supervisor immediately, and they will follow the exposure control plan, whatever that is. So the supervisor will pull out the exposure control plan and follow the steps from there. But the first thing you want to do is make sure that you squeeze the site of the wound and then also wash your hands really good with soap and water. Other than that, I think that is pretty much what the quiz is over. So, personal protective equipment, the gloves, the gown, the mask. The only thing that's required when we draw blood is gloves. We do not require a surgical gown. We do not require, goggles. As far as masks, that's only because of COVID. We've never used masks before, but now they may require because of COVID. But that's not because of blood drawing. The only thing that has really been required is disposable gloves that we have to change between each patient for personal protective equipment. So one of the areas, you can see different contact precautions, like if a patient is infected with a disease, we will do contact precautions. So they are required to wear the mask, the hair bouffant, the gloves, and the gown. That's what's required in contact isolation. What contact isolation is touching a patient. Like you touch someone and you pick up a bacteria, and then you can transfer it from patient to patient. The number one way we can prevent the spread of infection is hand washing. but also protecting our scrubs and anything that we have can also help. The most common organism that is transferred by contact is Staphylococcus aureus. That's the most common. Now, when we look at some other things like airborne, that's most common is COVID or tuberculosis is an airborne. And then droplets would be the flu. But contact isolation is Staph aureus, or another term of that would be Staph, or MRSA, methicillin-resistant Staph aureus. Now, if you have an airborne isolation room, like the patient is in an airborne isolation, they are required to wear a respirator mask. See, it says right here, put on the fit test, and an N95 mask is required. They also have to wear goggles. No, they don't have to wear goggles. They have to wear a mask and probably a gown and wash their hands. So it shows here that they must clean their hands, include before they enter, and then put on an N95 mask or a high-level respirator, and then remove respirator after exiting the room and closing the door, and then they would wash their hands. So those are the things required in an airborne isolation. In a droplet, they have to wash their hands, and they just wear a surgical mask. Some require gown and gloves, some don't. It depends on. It says use standard precaution. So a lot of times glove and gown is just kind of known, like they wear those no matter what. But that should cover all the information that you need to know for your quiz. So take a look at this video. Hopefully it helps you. Take some notes on it. And if you have any questions about it, please, I'm going to send this to Professor Matthews as well, and she can take a look at it and help you guys learn from it as well. So that's all I have for you guys. Have a good weekend, and we'll see you Tuesday.